Hello everyone, welcome back to Comment Made Easy, and I hope you all are doing very well. Before we begin, let me remind my dear students that the contents of this channel are only to supplement your knowledge, not to replace the regular online and offline classes in your institution. So please attend your classes and do not miss them. Also, if you like our contents, please subscribe to our YouTube channel, like the videos and share these videos with your friends, with your batchmates, with your juniors. Also, if you are a teacher, then with your students. Please follow our Facebook page and the link will be given in the description. In last couple of videos, we discussed about the clinical features of dengue hemorrhagic fever and dengue shock syndrome, and also different pathophysiology behind all these clinical features. Today we shall talk about the diagnosis of dengue and what are the necessary investigations that is to be done in a patient of dengue. The clinical evaluation of such a patient includes detailed history taking, thorough clinical examination, investigation and also assessment of the disease phase and its severity. Let us first talk about the patient's history. There are certain things that we need to ask the patient in details. First is to know the date of onset of fever. So when the fever started, rather than for how many days he is having the fever, because sometimes patient may give us wrong information. Maybe he does not remember for how many days he is having fever. It is easier for him to remember that on this particular date I started having the fever. So date of onset of fever is more important. Also, history of dengue fever among households. So if any other family member or anyone in the neighborhood or even living in or recent travel to a dengue endemic region, if there is any travel history in such region, so all this history are also very important. Also about the history of chills, rash, facial flush, etc. Retroorbital pain, arthralgia, myalgia, malaise, etc. So these are all the clinical features. Along with that, history of persistent vomiting, with or without diarrhea, pain abdomen, etc. Shortness of breath, bleeding from any orifice, any bleeding spot on skin or mucosa, reduced urine output, cold peripheries, profuse sweating, postural dizziness, blurring of vision, yellowish discoloration of the skin or mucosa, and altered sensorium. So all these things must be asked in details, and these informations are very important because they will tell us about whether any bleeding manifestation is there or not, and also certain other complications like hepatitis is happening or not. You can see here the features of jaundice, yellow discoloration of the skin, if there is profuse sweating, postural dizziness. So if any feature of shock is there or not, reduced urine outputs, maybe kidneys compromised, bleeding from any orifices, bleeding spots, skin mucosa, as I said, hemorrhagic manifestations. So all these things, if they are present, it is very important to know about that. There are 3 golden questions which are to be asked to assess the hydration status from the history. So we need to ask the oral fluid intake, quantity and types of fluid. So how much fluid he is taking and what are the kinds of fluid he is taking. The urine output, quantity in terms of frequency and estimated volume, and time of most recent voiding. So whether he is passing urine frequently and the amount of urine. So that will give us an idea about the hydration status, also the kidney functioning. Types of activities performed during his illness, for example, whether the patient can go to school or work or market, etc. So all this will give us some idea about the hydration status. These 3 questions are known as the 3 golden questions. There are certain other questions which are not specific to dengue but also give us a good indication about the hydration status of the patient and also how he is coping with the illness. For example, if there is any other fluid losses such as vomiting or diarrhea, if there is any presence of warning signs, particularly after first 72 hours of fever. We know about warning signs that we discussed in our first video on dengue. Other relevant history that we must look for is the history of medication. So whether any non-prescription medication or traditional medicines are being taken or not, and when they were taken, etc. Especially if you remember, in any case of viral fever or viral infection, we try to avoid any kind of NSAIDs, right? Because that affects our liver, can lead to Ray's syndrome, etc. And also if there is any risk factor. So all these things should be asked thoroughly, and this is about the history taking of the patient. Next is the clinical examination. Now we need to assess few things. For example, temperature, giving us the idea about his status of fever. Blood pressure, we know in case of dengue there is hypotension. Mental status, maculopapular or macular confluent rashes. Conjunctiva has to be looked at, if there is any conjunctival hemorrhage or not. Status of hydration, etc. Tachypnea, acidotic bleeding or pleural effusion. Abdominal tenderness, hepatomegaly, ascites, all this can happen. Also, we must assess the peripheral perfusion of the patient, and that is done by holding the patient's hand and assessing what is known as CCTVR. What is CCTVR? It stands for the color of the hand, capillary refill time, temperature of the extremities, pulse volume and pulse rate. So, as you can see, this doctor is holding the hand of the patient and he is assessing the CCTVR. So, he is pressing on the finger, probably looking for the capillary refill time. He is also taking the pulse here. That will give him some idea about the pulse volume and pulse rate. Also, by holding, he can know the temperature as well as he can look at the color of the hand. So, this is CCTVR to assess the peripheral perfusion of the patient. Next is Tourniquet test has to be done. If previously the Tourniquet test was done and the result was negative, the test can again be repeated. Now let us talk about Tourniquet test. It is a marker of capillary fragility. So a positive Tourniquet test indicates there is capillary fragility. So how to do a Tourniquet test? What are the steps? We often ask our student about the Tourniquet test. So this is an important Viva question. First, we need to measure the blood pressure of the patient. That will give us the systolic as well as the diastolic blood pressure. In this example, say the blood pressure is 100/70. Next, we have to inflate the cuff of the blood pressure machine, that is a sphygmomanometer, to a point in between the systolic and diastolic blood pressure. So what is the mean or the midpoint between the systolic and diastolic? 100 plus 70, that is 170 divided by 2, that is 85 millimeter of mercury. So we have to inflate the BP cuff up to 85 millimeter of mercury and maintain at that pressure for 5 minutes. Okay, then we have to deflate the cuff. Okay, we have to let the air inside the cuff go. So you reduce the pressure and we have to wait for 2 minutes. After 2 minutes, we count how many petechial spots are there in 1 square inch area in the antecubital fossa. Alright, so this is what the petechial spots look like. As you can see on the right hand side, these dotted things are the petechial spots, and this is the elbow, the front of the elbow, that is the antecubital fossa. Okay, whenever we have 10 or more than 10 petechial spots in 1 square inch area, it is said that the test is positive. In dengue hemorrhagic fever, that means when there is already hemorrhagic manifestations occurring, we can have 20 or more than 20 petechial spots. But remember, in case of profound shock, the test can be negative or can be mildly positive. So maybe few dots are there, few petechial spots are there, but in 1 square inch we may not have 10 or more than 10 petechial spots. So this is a test for capillary fragility which is done in the case of dengue. So this is about the Tourniquet test. Next, coming to the investigations. What are the investigations to be done? First, we need to confirm the diagnosis, and the recommended test for confirmation of dengue that is recommended by the government of India is the NS1 antigen detection and immunoglobulin M for dengue. So ELISA based antigen detection test, that is NS1, which can be done from the very first day of fever. So if the patient has fever from today, this test can be done from today itself. The second test is IgM or immunoglobulin M capture ELISA, that is also called MAC ELISA, but this is done from the 5th day onwards of the disease. So for the first 5 days, ideally it is said that after 120 hours, this test can be done. In the first 120 hours, this test should not be done because immunoglobulin takes some time to appear in the blood. So that is why IgM for dengue, the MAC ELISA, is to be done from 5th day onwards. So these two tests are for diagnosing, or rather better to say the confirming the diagnosis of dengue. Apart from that, there are certain other investigations to be done to know about the status or the progression of the disease. We have already confirmed that the patient has dengue. Now what is the progression of the disease, whether he is getting better or whether he is getting into the critical phase, that is to be known, because based on these findings the management of the patient may vary. So we need to do complete hemogram. At the first visit, the complete hemogram is done to know the baseline hematocrit. This is very important, and this hematocrit should be repeated after 3 days of illness or in case of any warning sign or risk factors for the severe disease. We have to compare the baseline hematocrit that we did on the first day of visit as well as the repeated hematocrit level that we did after 3rd day. Suppose the baseline hematocrit is not available. So before going into the critical phase, when the person was in febrile phase, maybe the hematocrit level was not done. So it is very difficult to compare because we do not have any baseline information. So in that case, what we do is we go for the age specific population hematocrit level as the surrogate for comparison. So if the baseline hematocrit level is not present, in that case we can assume that there is plasma leakage when there is 40% hematocrit rise in children less than 12 years or in adult females, or if there is 45% hematocrit rise in case of adult males. So remember, when the baseline hematocrit level is not present, in that case just looking at these figures, whether the hematocrit level has increased more than 40% in case of adult female and children less than 12 years, and also more than 45% in case of adult males, then we can suspect there is plasma leakage. So more than 40% of what? 40% or 45% of the population, age specific population based hematocrit level. So this is the standard. Generally, when we have rapid decrease in platelet count, so thrombocytopenia is occurring, as well as concomitant rising hematocrit as compared to the baseline, this is suggestive of progressive plasma leakage or critical phase. So if in any patient with fever who has been diagnosed to have dengue and the complete hemogram shows us that there is rapid decline in the platelet count as well as increase in the hematocrit level, that is indicating that the patient is going into the critical phase. Also, leukopenia usually precedes the onset of critical phase. So even before this occurs, this platelet count drop as well as hematocrit rise, first what happens is leukopenia. That means the WBC count goes down, and that is because of the destruction of the myeloid proliferative cell in the bone marrow. So there can be leukopenia with relative lymphocytosis in dengue. We know because of the destruction and inhibition of the myeloid progenitor cells, there is drop in WBC count, that is the leukopenia. But as a response to any infection, we have increased lymphocyte. So even though the number of WBC is decreased, the lymphocytes seem to be increased in number. This is known as the leukopenia with relative lymphocytosis. There can also be thrombocytopenia where the platelet count can go below 1 lakh per cubic millimeter. And this is because of two reasons. One is the destruction of platelet in the circulation, as well as because of the destruction and inhibition of the megakaryocytes in the bone marrow. And megakaryocytes are known to produce platelets. So in any patient having fever, if we get drop in WBC count and platelet count, then the diagnosis of dengue is very likely. Of course, we have to confirm the diagnosis by NS1 antigen and IgM estimation. We know in dengue there is plasma leakage because of increased capillary permeability. So because of plasma leakage, there is hemoconcentration, and this is known as increased hematocrit level. For the age and gender of a person, if there is more than 20% rise in the hematocrit level, then it is known as hemoconcentration, and this is very likely a case of dengue. Also, when we give the volume replacement treatment or therapy by intravenous fluid administration for management of dengue, there is 20% or more than 20% drop in the hematocrit level. So these are the important blood picture in case of dengue. So now we have diagnosed dengue. Also, from the complete hemogram, we have known about the status like hematocrit level, WBC count, platelet count, etc. What are the other investigations which are needed in case of dengue? And these mostly detect the different complications of the disease. For example, we have to estimate the liver enzymes by liver function test. So AST, ALT, etc. And there is rise of AST, also known as SGOT, more than ALT, that is SGPT. The degree of rise of AST and ALT are more in case of dengue hemorrhagic fever and dengue shock syndrome as compared to the classical dengue fever. We have to estimate the glucose level, serum electrolytes, urea and creatinine, specific gravity of urine, giving us some idea about the kidney functioning, bicarbonate and lactate to know whether there is any acidosis, alkalosis, etc. Cardiac enzymes, electrocardiogram to know about the cardiac functioning, chest x-ray that will help us detecting the pleural effusion. We know there is fluid accumulation in different part of the body because of the plasma leakage. So chest x-ray will help us to identify any fluid accumulation in the chest, that is pleural effusion. Also ultrasound that will help us detecting the status of the liver, whether there is any hepatomegaly or if there is any ascites in the abdomen. We can also go for the echocardiography to know about the functioning of the heart, etc. So all these investigations are also important in case of dengue. Management of dengue depends on the phase as well as the severity of the disease, and based on the phase and severity we decide whether a patient needs to be admitted in hospital or whether he can be treated at home. If he needs hospital admission, then what kind of treatment is necessary for that patient. So all these things are dependent on the phase and severity. To assess the phase as well as the severity of the disease, we need to go for the detailed history taking, thorough physical examination along with different investigations like complete hemogram, hematocrit level, platelet count, etc. Also looking for different warning signs. We have to know about the hydration status of the patient, whether the patient is hemodynamically stable or not. All these things has to be considered before making the correct decision. Now, the management of dengue, including classical dengue fever, dengue hemorrhagic fever, dengue shock syndrome, will be discussed in details in our next video. But before we finish today's topic, we must discuss one more important thing, that is the expanded dengue syndrome. We said that because of plasma leakage, there is hypoperfusion in different major organs in our body. So that is why sometimes we can have mild or severe organ involvement, and that may lead to certain unusual manifestations. This is known as expanded dengue syndrome. So let us look at some of the manifestations that we can have in expanded dengue syndrome. So if there is involvement of central nervous system, we can have encephalopathy, encephalitis, febrile seizure, intra-cranial hemorrhage, etc. GI involvement in the form of acute hepatitis, fulminant hepatic failure, cholecystitis, cholangitis, acute pancreatitis, etc. Renal involvement leading to acute renal failure, hemolytic uremic syndrome or HUS, ATN, that is acute tubular necrosis. Cardiac manifestations include cardiac arrhythmia, cardiomyopathy, myocarditis, pericardial effusion, respiratory system involvement leading to pulmonary edema, ARDS, pulmonary hemorrhage, pleural effusion, etc. Eye involvement. We can have conjunctival hemorrhage, macular hemorrhage, visual impairment, optic neuritis. These are the mention of only few symptoms or clinical manifestations, better to say, not symptoms. There can be even bigger list. So if you look into different sources, you will have a more detailed list about the expanded dengue syndrome. So today we have learned about how to diagnose a case and also how to investigate a case. That means starting from the detailed history taking, then thorough clinical examination, blood test and other necessary investigations, etc. That is required for deciding on what kind of treatment the patient needs. With this, we conclude today's session. If you like the video, please subscribe to our channel and share this video with your batchmates, juniors and friends. We also have our Facebook page that you can follow. The link is given in the description. Take care and we shall see you in our next video.